So when you come into the, this is Dr. Analek, when you come into volunteer, you want to make sure that you first of all sign on the volunteer sign-in sheet. Just so that you can, number one, get credit. If you have credit, you can use that for your the 2 hours that every 2 hours that you work here at the clinic, you can get 1 hour of continuing education credit. Also, we have a mock-up chart here to show you what example of a chart would look like. So these are paper charts, obviously. We would have what they're allergic to on the outside. And then on the inside, we would actually have a set of radiographs right here. On the x-rays, when we take them, we want to go ahead and print them out right away. And when we do that, we just mount them right here on this portion of the chart. There's also other things inside of the chart here, like their health history here. We have any messages that have been taken place so that we can have good communication with those who volunteer at the front. This has, once again, inside of the chart itself, it has eligibility forms, it has their dental history form, it has their medical history form here. So this is really important. And then we also have here is their health history, and then the dental history itself is right here, as you can see. So we ask questions about periodontal disease, if your teeth are sensitive to whatever they might be sensitive to, if they're currently experiencing any pain, if they clench or grind their teeth, their past dental history, and the reason why they're seeing visit today. So this is all right here underneath the x-rays on this portion. Over here, we have a routing slip. Each patient, as they have treatment done, it's going to be put on the routing slip. Then for their next appointment, a new one will be filled out by the patient's name, what was currently done today, what is next visit, in hygiene or by the dentist, and we're going to describe what things have been done with that. This will come from our treatment planning sheet, which I'll show you. So we have here a pretty basic type of thing right here. This portion of it is preserved for periodontal charting only. This way we can chart along these numbers, and as we need more, we just add more in here. This here is for the oral evaluation. We try to, use, maybe not everything is covered on this, but you will get a good idea of what's happening with the patient at their initial exam portion, whether they'd have a good health history, what their tissues look like, making sure that they have the cancer check is negative. You might also see the words W and L, which means within normal limits. A lot of times that will be used on this portion too. Also for their, in this portion right here, we're going to put probably pretty much the initial visit, the initial SOAP, subjective, objective assessment, and then plan for a patient, what's happened in this portion here. Now, if we flip this over, now we're going to have our progress notes for a patient. This portion here, we really don't use that much. We use here about progress notes. Each day has its separate date entry here, what services were performed, the local anesthetic used, these surfaces. If you do a tooth, you do tooth number here, you put the surfaces, the type of material that's been used, what findings were there. And at the end, you want to initial, the doctor will initial their, right here, at the end of the progress notes. If any assistants go ahead and make notes, they also need to initial it because we have many volunteers and we want to make sure we know what's happening there. So each time it'll have the services rendered here in specific details, once again, that are written legibly by hand. So that's that. Now, just underneath that is our treatment planning form. Our treatment planning form is we don't really assess when somebody comes in what their current situation is. We really just go right into treatment recommendations. So, for example, in this chart, the numbers go from 1 to 32. And so each one would cover each tooth in the mouth. We would have here, if we have a tooth that's missing, we're just going to go ahead and a line will be marked right through that area. So each tooth, so this person's missing 1, 17, 18, and 32. And then during the planning mode, we will actually go ahead and write in if you've done something, whether it's, stop that,